Okay. So good morning and welcome to Generate Health's second webinar, Navigating COVID-19 for Moms and Babies. Before we get started, I just want to share some housekeeping information. Because we have so many attendees, we have everyone muted. But we do encourage you to share your questions and information and resource sharing. So please use the Q&A function at the bottom of your screen to send us your questions, and we'll address all of those questions after all the panelists have spoken. And next, we want you to use the chat box for all of your information and resource sharing. On our first webinar, we had lots of resources that were shared. We will capture all of those and we will send that information out after the webinar along with a copy of the recording. So please keep those resources and information sharing going. We are recording the webinar, so we just wanted to make sure that you knew that, and we will have it available for you to share more broadly later. Just want to tell you a little bit about Generate Health. We are a maternal child and health coalition. We were founded 20 years ago, and our mission is to mobilize the region to advance racial equity in pregnancy outcomes, family well-being, and community health. We see it as our role in this crisis to convene the maternal child health community to share information about how people who are pregnant and postpartum are affected and at risk for COVID-19. We want to be able to coordinate resources that respond to the needs and services for providers and the community at large. And we want to identify collective action opportunities. So this webinar essentially seeks to crowdsource information about needs, resources, and solutions to the challenges that the community and organizations are facing. It is our goal to bring a racial equity lens to this discussion. We want to take a look at how the maternal child health community can be thoughtful and responsive to ensure that COVID-19 doesn't exacerbate the current racial disparities in our areas. Before I introduce our panelists, I would like to take a moment to dedicate this webinar to our dear friend and colleague, Judy Wilson Griffin. And for those of you who follow our Facebook page and receive our emails, you know that we have created a tribute to Judy's leadership in our coalition and the maternal child health community in general. Judy touched the lives of so many moms and babies as well as her colleagues, and we look to her wisdom and her spirit of collaborative action as a guiding light during this time. I'd like to just take a moment of silence in her honor. Thank you for allowing us the opportunity to dedicate this webinar to her. She will truly be missed. At this time, we have the honor of having Dr. Echols in the building, and we know he's super busy with everything that's going on, so we want to give him an opportunity to address the panelists as well as all of our attendees. So Dr. Echols, you have the floor. Welcome.
Oh, there you go.
Good morning. How are you today?
Good morning. Thank you for stopping by.
So I just want to take a couple of minutes. One, just to say thank you to Generate Health and the work that you all do to protect, our families in the community and all the participants who deem this to be an important priority because they're tuning in today. The City of St. Louis Department of Health, as you mentioned, has, we also share your passion as far as making sure that we address issues using a health and racial equity lens to make sure that individuals that need services receive them. For COVID-19, this has been a real challenge for public health departments across the nation, as everyone has seen. One of the challenges with public health is oftentimes we rely on the science, but sometimes government likes to lag behind because of their lack of understanding, et cetera. And so our role during this time has really been that of an educator. So making sure that our elected officials, our community members understand the importance of the preventive messaging that we issue out. But it's also important that they understand that there are myths and misinformation that are adversely impacting our communities. And so again, as we serve in the role as an educator, our responsibility is to make sure that we're getting accurate information to not only the people that work for us, but also the individuals across the region. And so we've done a decent job of working with media outlets across the region through our public information officers. And then again, the goal is to make sure that families can protect themselves during this time. But as we also know, there have been some community mitigation strategies that have been necessary to slow the spread of COVID-19 in our communities. And with those strategies, we oftentimes have unintended consequences. For example, closing schools. So beyond spring break, that can pose challenges for families that may not have the financial means to provide meals and so forth for their children. And so we've been working really closely with the St. Louis public school system, as well as the charter schools and other parochial schools, as well as the archdiocesan schools across the region, to make sure that food can be made available for students beyond spring break. And so everyone is kind of rallying together to make sure that the needs of the community are met. And we really appreciate everyone really chipping in and not needing to be the leader, if you will. So everyone is really understanding what the mission is and feeding into that mission. So to ensure that we are minimizing the impact of these unintended consequences that arise when we have the need to implement community mitigation strategies. In addition to that, as you mentioned before, there are a lot of health inequities that exist in our community. And oftentimes these inequities are highlighted when we have situations like COVID-19 or other large outbreaks. And so this isn't something that we take lightly. There's a lot of work that we have to do to address these issues, because again, these issues didn't happen overnight. These are systemic issues that have been in place for decades. And so as we navigate these issues during this time, it's really important that we look at our vision, not just the vision for COVID-19, but our vision moving forward for the next 5 to 10 years, and really identify what our end goal is going to be for addressing these health and racial inequities that are adversely impacting our not only the lives of our staff, but the lives of our community members. So again, we really appreciate having the opportunity to work closely with Generate Health and all of our partners across the city of St. Louis and the St. Louis region, because this is necessary. And again, it's beyond COVID-19. COVID-19 is just a situation that we're navigating now, but these issues that are causing these adverse health outcomes for our families are systemic issues that we have to call it out. We have to call it what it is, and then be willing to address it no matter what the cost.
Thank you, Dr. Echols. We appreciate you giving us time today. We know how busy you are, and thank you for all the work that you're doing in our community. We know that we can make remarkable things happen when we work together. We will host a webinar next week so we can continue the dialogue, adapting to the changing needs and conditions. So today's webinar will cover hospital labor and delivery protocols, an update from the Department of Health from the city. And we also wanted to reach out and get community response. So I'll introduce all of our panelists up front so that we can move more seamlessly between speakers. So Jeannie Kelly is Assistant Professor of Obstetrics and Gynecology for the Division of Maternal Fetal Medicine at Washington University School of Medicine. Yvonne Smith is the Director of Women and Infant Services at Barnes Jewish Hospital. Emily Combs is the VP of Operations for Women's Services and Neuroscience with Mercy Hospital. Pamela Lesser is going to join us a little later, and she's the Director of Perinatal Services for SSM St. Mary's Hospital. Candice De Silva is the Health Services Manager for the Bureau of Women, Children, and Adolescent Health for the City of St. Louis Department of Health. And Lakeisha Riddick is the founder and doula for Virtuously Birth Doula Services. We'd like to thank all of our panelists today for giving us some time and for checking in with us. And we will start with Jeannie. Thank you.
Hey everyone, can you hear me today?
We can.
Great.
Yes.
Thank you guys so much for inviting us to come speak. I am going to give a quick overview of what our labor and delivery protocol is at Barnes and WashU. I apologize about how cluttered this slide looks, and I'm going to just walk through it with you guys. So over at Barnes Jewish Hospital, we've been furiously preparing and planning and looking ahead, knowing that the surge and the peak of COVID-19 is coming for the St. Louis region. This flowchart started a lot simpler than this and has really expanded over the last couple of weeks. But one of the unique things about where our labor and delivery is located is we are in Parkview Tower, which is a building that also houses the bone marrow transplant ICU and also the oncology ICU. So one of the unique things to our labor and delivery is that we share the space, a lot of the public space, with an incredibly vulnerable and immunocompromised group of patients. And because of that, our whole tenet of developing our algorithm is we really are trying to cohort our suspicious PUI or persons under investigation for COVID-19 or known COVID positive patients. We're really trying to cohort them off of the Parkview Tower campus away from this incredibly vulnerable group of patients that we have there. So that's kind of the tenet that we started with. That unit is over on Barnes Jewish South, which is the COVID unit, and there is an ICU level unit there for ICU level care, and also a floor ward for patients who don't require ICU level care. So as of yesterday, we actually implemented a screening tent in front of our Parkview Tower. And so the purpose of our tent right now is really to separate out patients who come into labor and delivery who are at high risk of, they are either just, they are a high risk for COVID-19 just by symptoms or by their history or by their presentation, or are at increased risk for becoming one. So every patient who is coming onto labor and delivery, which is whether they're there for a scheduled C-section or they're there because they woke up with a fever and didn't feel well and kind of walked in for further evaluation, every patient is coming through our tent. And by their symptoms and history, by their screening, they kind of get separated out into these 4 categories of risk to become a person under investigation for COVID-19. After they're separated out, this is kind of their workflow in our tent. So someone who's in that intermediate risk category, the low risk category, or the unknown risk category, they are masked if appropriate and brought up to labor and delivery for further evaluation. They're not considered a person under investigation, but they have varying risks to become one. The high risk category are patients who come in and they have symptoms or a history or both that are really concerning for COVID-19 that essentially puts them into the category of a person under investigation. And for these moms, again, our whole tenet is to try to really protect the really immunocompromised patients at Parkview Tower. Our goal in the tent is really to triage them in the tent. So if they're doing overall okay, they have a fever, but we're able to get it down with some Tylenol, their vital signs are not worrisome, their baby looks pretty good on the monitor, and they're able to eat and tolerate intake and fluids, we really want to kind of keep them in the tent, help them triage their symptoms, and then direct them over to the emergency room for testing of COVID-19 if that's appropriate, and give them discharge instructions. If someone is really sick in the tent and they really need further evaluation, we get our transport team there and get them immediately to the emergency room. And if someone has all the symptoms of COVID-19 and is also in labor, that patient gets brought into Parkview Tower because we think that's probably the most appropriate place for them. Once mom is in Parkview Tower, and let's say they go through the screening, can you guys see my mouse when I move it?
Yes.
Excellent.
Yes.
So once they go through the tent screening protocol, so they're category 1 high risk, all the other categories go up to our Parkview Tower. If someone becomes a person under investigation, everyone gets masked. And our PPE, I think this is kind of a mess everywhere in the country right now, determining level of appropriate personal protective equipment to wear. But we've decided that if someone's critically ill requiring high flow oxygen, we probably need an N95, that higher, the higher risk mask on to protect ourselves. But through this, they get roomed into one of our negative pressure rooms. If they're not already roomed, if they're already in a room, we do not move them. We simply just close the door and make sure that everyone is appropriately protected. We then test them for COVID-19. And so again, from that category 1, that high risk category, the only patients that really come up through Parkview Tower is if they're laboring. And if they need immediate delivery, we actually turn one of our negative pressure rooms into a functioning operating room. So moms can go ahead and labor and deliver in one of these negative pressure rooms. Or if they end up needing a C-section, we actually have the capability, we have a ventilator in the room to go ahead and perform the C-section right there in the room. And that again is a decision that we made because turning our normal operating rooms into a negative pressure room was more logistically complicated, and dealing with kind of the logistics of getting wheeling a mom out of a labor room into the operating room, a mom who is COVID positive, also logistically was difficult for us. So we've essentially adopted this in the room C-section setup if that is needed, hopefully not. And we have all of the anesthesia teams available with the ventilator in the room if these moms become unstable in their respiratory status. So if they're positive, they go ahead and get delivered in the room if they need delivery. And then when they're postpartum, all COVID positive moms get transferred again to the COVID unit, where we're trying to again protect the population that is in Parkview Tower. If they're not in labor, but they became a PUI and they're positive, under our service, they also get transferred to that COVID unit. And we bring everything we need with that patient to monitor the baby, monitor mom, and deliver the baby in the ICU room or in one of the nearby operating rooms in the COVID unit. So we're set up for kind of a dual labor and delivery in our typical labor and delivery, and also over in the COVID unit. We additionally have a pathway if mom goes to the emergency room. We have kind of like a large campus, so sometimes mom comes straight to labor and delivery, sometimes mom goes to the emergency room even if they're in labor. It's confusing for me, and it's triply confusing for our patients where they're supposed to go. So for our moms who end up in the emergency room, we actually just ran a simulation with our emergency medicine doctors. We have all of the supplies ready to deliver them right there in the emergency room if they're in advanced labor and cannot be stably moved. If they are a person under investigation or high risk for COVID-19 or positive, they get again moved to the COVID unit. And we have an ability to do a C-section over there in one of the nearby negative pressure operating rooms, and then transport them to the COVID unit if they are positive. So I know it's crazy complicated, and I think we've really spent, I think all hospitals across the country are really struggling to think through every single possible scenario and think about what the safest way would be to kind of help get mom to the most appropriate place that protects her baby, but also protects every other patient in the hospital and all of the healthcare workers as well. So that is our current sort of workflow at Barnes-Jewish Hospital for moms who are coming in and moms who may be high risk for COVID-19.
Thank you, Jeannie. And I'm going to turn it over to Emily.
From a hospital perspective, we have really looked at how we will identify our PUI patients and how we can make sure that a PUI patient does not make their way into the hospital without being screened. We are currently screening 100% of our patients on entry, our visitors, and our coworkers. So all of our patients are being cared for on our labor and delivery unit, whether they are a PUI, COVID positive, or a general patient. We are providing care on our labor and delivery unit. They would enter at our main entrance where they would be screened by our screeners, go to our maternity welcome center, and then be triaged appropriately. If somebody is suspected of PUI or COVID, we are asking that they reach out to their OBs. The OBs contact the hospital so that we know that they're coming. We would mask them upon entry into the hospital. Let's see, I'm trying to think what, it's pretty similar. A lot of ours is pretty similar to BJC. I'm trying to think what's a little bit different. So just as BJC has a tent, our ED has a tent as well. We do encourage anyone who is pregnant with mild respiratory symptoms to be seen at one of our off-site locations. We have 3 throughout the St. Louis area, and then we have a tent outside of our ED on campus. We have talked a lot about visitor exceptions. So throughout Mercy, we have very few areas that are still allowing visitors. Our OB population and pediatric population are the 2 areas that we are still allowing visitors. We do ask that that visitor is somebody who is asymptomatic, and that person can stay with a non-PUI or COVID patient the duration of their stay. If somebody is a PUI or COVID positive patient, we allow that visitor to remain with them throughout their labor, the 2-hour recovery period, and then we do ask that they leave the premises just to protect, as we continue to protect our other patients, coworkers, and babies. Just like BJC, we also have several COVID units throughout our hospital right now based on acuity of the patient. A mom is encouraged by all the current literature to be separated from her baby after delivery. So we would move mom to a COVID unit. The baby would go to our mother-baby unit where they would be cared for one-on-one with one of our mother-baby nurses. So that's something that's been, I think, a big source of anxiety for a lot of our moms. Obviously, it's up to mom if she wants to remain with her baby, but as medical professionals, we do encourage and educate to the latest literature that definitely supports mom and baby being separated after delivery. We are working with, what I think I'm most proud of being in St. Louis is Mercy, SSM, and BJC with several other healthcare systems have really worked together from all aspects so that we can make sure that we're serving this community the best way possible. We have not worked in silos in any service line or any organization. So I think a lot of what we have done has really been a community-wide group effort to best serve the community that as we approach this pandemic. And I think every day in St. Louis, we're seeing more and more patients. You know, we have several pregnant patients in the queue right now that are positive. So just trying to really work with those patients, make sure they have the education prior to coming in. I think that's what's so important, is making sure we know these patients are in the community so that we can set expectations. Because if they have the knowledge and know what to expect when they come into the hospital, it's not such a surprise for them. You know, I think for a lot of people, if this isn't their first baby, seeing a nurse come in because you're a PUI or COVID positive patient, gowned and masked all up, it is a little bit frightening at first. So we've really tried to set the precedence of what that experience will look like for you. One of the things that we are encouraging at Mercy, which is in line with ACOG, is early discharge. So really trying to make sure that we start discharge teaching on admission, and for a vaginal delivery after that 24-hour mark, and then a C-section, the 2-day mark, just to get them home. We have really thought through what will they need after an early discharge. So we've done a lot with our childbirth classes. We are working on a support group, lactation services after discharge. So really making sure that we're not saying you're going to leave. And again, it's not mandated, but it's something that we are encouraging after that 24-hour mark, that you'll still have resources and a support phone numbers available to ask questions to make sure that you still have the support. Because obviously there is a very high likelihood with postpartum depression and other issues with everything that's going on, and definitely not being the birth experience that many of these families had planned.
Yes. Thank you, Emily. I want to
Sorry for
remind.
my technology issue.
Oh, it's okay. Again, it's all grace today. That's the word of the day, grace, as we navigate this new normal. I will remind our attendees that if you have questions, if you would drop those questions in the Q&A box, and that way when we get through all of our panelists, we can go directly to the Q&A box and grab those questions. If they're buried in the chat box, sometimes it's hard to get to those. And use the chat to have information sharing and resources. So information sharing and resources for the chat, Q&A box or function for all of your questions. Awesome. So we are going to transition to Pamela Lesser, who is going to talk to us about what SSM St. Mary's Hospital is putting into place.
So I only see the camera for Pam. I don't see a microphone or a phone, which would be audio.
Okay. Pam, do you have access to audio? So technology. Oh, someone's helping. Technology.
Okay, can you hear me now?
We
Yes.
can.
Here, Becky, just turn it off. Just turn it. Okay, how about now?
We can. Awesome, Pam. Welcome.
Oh, thanks. We're kind of muted here on my end, but we're gonna try to figure out how to get the volume up, and I
We
can
can-
hear stuff. So
Okay.
I don't have a whole lot put together to present, other than to be here and kind of share a little bit and see what questions we can answer for people. Sorry, we had a lot going on today.
Yes.
So SSM has worked together very much in what we've been doing and putting our plan and our system together. And as Emily mentioned, you know, obviously the systems have all been working together, which I think is awesome that we've been able to do that. So unfortunately, all of our SSM hospitals have a little bit different setup. And so I can speak mostly to what we at St. Mary's as the high risk center are able to provide. So at this time, we are really encouraging moms who are coming into the hospital, if they have a viable pregnancy, so 22 weeks above thereabouts, so that we would like those moms really to come in through our regular entrances like they would normally do. We have screening at each of our doors, and as at most of the other hospitals, that screening is done for anyone walking in, whether it's employees, staff, patient, visitors that are coming in. The mom would come up to our women's evaluation unit. We do another screening up there for everyone who comes in. We would like that any mom who is either being sent over or is coming in from her doctor's office and we know is symptomatic to give us advanced warning, and we will get her a mask at the doorway. And we have a designated pool of rooms that we are using in triage for our COVID positive or PUI moms to present to be ruled out as to what's going on and whether or not we're going to keep them or send them back to the community. As Emily talked about, any mom with mild symptoms, please call your doctor's office and get directed to one of the outpatient screenings. We would think it best for you and for everyone to not come to the hospital and really have that managed at an outpatient or a virtual site visit, either virtually or through one of the drive-throughs. Excuse me. Anyone who is earlier in pregnancy, we would have go through our regular emergency room. And they will be managed like other patients that come through there. Our OB team can go to them to do what we need to do. I do not have COVID. I'm sorry, I have allergies.
It's okay.
Pardon me. We are caring for our patients up in labor and delivery in our mother-baby areas, unless they are most critical. If they would need to be intubated, they would go to our COVID-1 unit, as everyone else. We have multiple COVID units throughout the hospital where we are segregating patients. However, because of the unique nature of birth and the celebration that goes with it, we have our own pregnancy segregated area for those moms. As everybody else, we are doing one family member visitor who can be with mom through the course of her labor. We earlier had been looking at doulas and really talking about them, recognizing doulas are care providers, not visitors. We are totally aware of that. However, in this current era, we are even limiting our staff members that are being in these rooms, and for the health and safety of everyone, would really like to support any virtual level of support we're able to provide, but not have them actually come to the hospital. The one visitor who is with the mom may remain with her. They cannot trade out. If baby does go to the NICU, mom and dad can both visit as long as mom is an inpatient. Once mom is discharged, we would go down to one visitor, and that's usually the mom, or one, I say visitor, parent, caregiver, who would be with that baby during their stay. And that, again, will not trade out over time. This is such a dynamic area. We are learning so much every day. While we have protocols in place, they do change somewhat day to day as we learn more from our colleagues and from what's going on out in the community and nationally. So we have teams, interdisciplinary teams with our infectious disease department that meet daily, as I said, to try to really be as up to date. And as patients come in, if we have a COVID positive mom who presents in labor, and we have not yet had one, we do very dynamic huddles in the moment to find out how best we can manage her in view of her illness and in the state of the current literature that we have at the time. In terms of supports and what we can do, again, recognizing that childbirth is such a unique moment and such a vulnerable time for women, we have now added a whole level of complexity to it that none of us ever expected. We do offer online childbirth classes. As we talked about in this last webinar, our Moms Line groups for our perinatal mood and anxiety support groups have all moved virtually. So while there's no video, we do have phone support groups that are running at their regular times. And today we have instituted our Weigh-In Wednesday here at St. Mary's to move to also a virtual platform that we are doing as phone-in support. We are at that level right now. We are exploring if there's a virtual way we can do lactation support beyond just phone. We obviously can do phone support with our lactation consultants at any time, but may look to some other platforms at this time. So, you know, we keep working with the community. We encourage moms who have questions about what their labor experience will be like to feel free to call. We will get them in touch up on the unit with one of the managers, kind of talk them through what that would look like. Again, recognizing this is so dynamic and that what we're doing today may actually be slightly different in 2 days from now, depending on what the community prevalence is and what things look like. So happy to answer questions. don't want to really reiterate a lot of what some of the others have said. We're really trying to learn to manage, when's the right time for hastening labor and moving things along. Really looking at that individually, and there's no set protocols that we are stamping that we manage everything this way in this presentation. So we'll work with moms and the physicians and the current knowledge that we have. So thanks, and happy to answer questions.
Yes, thank you, Pam. We're going to hold questions until the end. We have one more or two more panelists that we'd like to hear from, and then after they're done, we'll open it up to Q&A. So I'd like to relinquish control to Candace from the City Health Department.
Hi, good morning, everyone. And first and foremost, let me just thank the Generate Health team for putting this webinar together. Rose and Kendra, we appreciate this and the opportunity to talk more from a local public health agency standpoint, how we're continuing to support our moms. And so as our director mentioned, we are coordinating response efforts with local hospital systems. Thank you so much for that collaboration, and I appreciate the details shared from the other panelists. We're also working with our community health centers, the schools, and emergency personnel across jurisdictions to mitigate the spread and negative impact of the virus. Our maternal child health team here is small but a dynamic duo consisting of a registered nurse with over 20 years of experience engaging moms successfully in the community, and a health aide who historically has gone in to conduct home visits. We know that the uncertainty surrounding COVID-19 and the new normal that's operating under a declared public health emergency can cause a lot of fear, anxiety, and stress for families, particularly moms, because we know, and as we've even seen here with Zoom today, moms are the people who are taking care of everyone else in the family first. And so we want to continue to support them throughout this crisis. One of the ways that we're doing that is connecting moms to behavioral health providers and resources. The Moms Helpline was mentioned. We also do referrals to nurses for newborns. If crisis nursery is needed, that's a little bit more short term, but really finding those resources that will best meet the needs of our moms. During the pandemic, our team has pivoted and shifted all our energies and focus to supporting our communicable disease staff. They've really taken the lead on this. And so we have a maternal child health nurse responding to COVID-19 calls on our dedicated hotline. This is a really great resource for moms that I'd like to highlight today. That hotline is listed on our website, but I'll give the number. It's 314-657-1499. It's available 7 days a week from 8 a.m. to 10 p.m. We also have staff monitoring individuals who meet the criteria for persons under investigation. And our team has even gone out to deliver thermometers to those who are under quarantine so that they can continue to take their temperatures and so we can monitor them for the development of symptoms. One of the things we've also noticed here, and again, that the director mentioned, is there's no shortage of misinformation. And so unfortunately, for moms, they have that difficulty of navigating through a flood and of all of these different information coming their way. And so we want to make sure we could continue to provide credible, accurate, and timely information so moms feel empowered to make the best choices to protect against the virus and avoid infection. And so we have a lot of that great information listed on our website that's updated frequently, but we strongly encourage moms, if they have questions or concerns, to call our hotline. We could provide guidance on everything from breastfeeding to precautions that mom can take so she can, if she is indeed positive with the virus, that she could still connect with her newborn, which we all know is so important during these times, but so she could still avoid spreading the virus to her infant. I just want to take a moment to shout out all first responders, public health professionals, nurses, physicians who are fighting and combating this crisis on a daily basis. We've all been working longer hours to make sure that we can have an effective and efficient response to this. And so I want to just take a moment to acknowledge all the radical collaboration taking place across sectors, across systems, and across jurisdictions.
Thank you, Candace. Lakeisha, we'd like to Have you up next, please.
Good morning.
Good morning.
I first want to thank Generate Health for inviting me to speak on the needs of moms and babies this morning. I'm the community health worker on the panel. So some of the things that I've been seeing as a doula and a community health worker is moms are not finding formula, they're not finding diapers. You know, people are panic buying right now, and so there's a lot of things just kind of flying off the shelf. So my goal is to try to gather resources to give to those clients that I come into contact with, or even share it on social media. If I come in contact with anything community related, I'm sharing it, and so are the other community health workers and doulas across the St. Louis region. I know that some of us have had to fully integrate to virtual services in order to fully be able to service the community. So even striving to figure out how to support those people who lack technology has been an issue right now. So if they are, you know, Spectrum's giving free internet, but at the same time, what if you don't have a computer? So just kind of figuring out what phone numbers to call for, like things like unemployment, for food stamps, and because you might not have access to that technology, finding where to find diapers and stuff. So everybody's been doing a great job. The St. Louis Community Health Worker Coalition and the St. Louis Doulas of Color Collective, both of which I'm a member of. We've been doing a great job of striving to share all of that information. If we have a web page, we're sharing it to the web pages, we're sharing it to our Facebook pages, business pages, everywhere we can possibly you know, display that information. We're striving to do that. Some clients, especially my doula clients, are worried about coming into contact with someone who is COVID-19 positive when they're going into a situation where they're not having any symptoms. So some of them have been trying to consider home birth or laboring at home as long as possible before they go to the hospital, so they're not there as long and they're limiting their exposure themselves. And so everybody's just kind of, you know, rallying together, but sort of kind of panicking at the same time because we've never had to deal with it before. And so this is new for all of us. So right now, that's the community need and the community climate that I'm seeing. And like I said, we're just scrambling to try to find resources. There's a lot of good ones out there. There's a Google Doc that's kind of being updated daily that is shared to a bunch of websites as well for East St. Louis and St. Louis region. I'll probably find that information, that link, so that I can share it to the chat box. But there's a lot of things out there, and when we all know when there's a crisis, community really comes together, and that's the biggest love I have for St. Louis and the East St. Louis region. Like, we really come together and rally around each other and try to figure out how to help one another, and so that's where we are right now.
Thank you, Lakeisha. I now want to turn to your questions, and just want to remind folks, I'm kind of seeing some questions popping up in the chat box, to put your questions in the Q&A function at the bottom of your screen, and any resources that you may know of or any information that you'd like to share, if you would put those in the chat box, that would be great. And again, we're going to compile all of the resources and we'll send those out so that everyone has access to them. There's a question, and I'd like to share that now. It is to, I believe, so it says, my organization works with mothers who are making adoption plans for their children. Can you tell me your current protocol for allowing people into PVT for work purposes, such as adoption placement? What's the current duration of time between testing and results at the hospitals. And that's open to any of the hospital staff present.
So at St. Mary's, we have not had this come up. I would invite that person, if they were birthing here, to call us, and we will work with them to work out what the details are and what would work best. The results for inpatients from testing to results is somewhere between 12 to 24 hours most of the time.
This is Jeannie Kelly with Barnes-Jewish Hospital on Parkview Tower. We've also not had adoption come up yet, but I am sure that that will in the next few weeks as we move forward. I know that our visitation policies, just like every other hospital, has become a lot more strict, but I think for a adoptive parent, special consideration would absolutely be made, and we would try to work with that parent in that specific case to provide as much support as possible, including sheltering in place in the hospital with the baby. And our testing also currently takes about 12 to 24 hours as well. Too long.
And this is Emily from St. Louis. We actually have had the adoption situation, and we look at all of those on a case-by-case basis, obviously realizing the importance of that and definitely making exceptions in those situations. Our COVID testing is also taking 12 to 24 hours. We have seen up to 36 hours. I know Mercy and I think some of the other healthcare systems are in the queue to have rapid testing. They are outsourcing that to the states with higher prevalence first. So we're hoping in the next 3 weeks that we'll have the rapid 45-minute test available.
Thank you. Another question for patients with respiratory risks who have to go to another location. Are they seen the same day if needed?
So I think that was probably directed towards our workflow, where anybody who has respiratory symptoms gets sent away from Parkview Tower. And yes, they get evaluated on the same day immediately for those symptoms, with obstetrics involved as well.
Mm-hmm. Okay. I think that was directed to Barnes. There are a lot of things to remember, but what are the most important messages you want pregnant moms to know prior to coming for care? What would you tell an expecting mom who may be concerned about staying safe from COVID in the hospital?
I think the main thing is we just want moms to know that our labor and delivery nurses, our providers are committed to this being a wonderful experience, even through this pandemic. So just making sure that their questions are asked up front, so they're coming in well informed, I think is the main thing. And just making sure that they let the nurse know what their birth experience is. And we are working so hard. We have educated our nurses, our providers, just again, to make sure that the joy of pregnancy is still there. The joy of the birth is still there.
Thank you.
And I echo those sentiments. I feel awful for our patients who should be the happiest time in their lives, meeting their children for the first time in the current pandemic. I think it's important to let them know that these doctors, these nurses, the staff in the hospital, we are still showing up to work every single day. We are taking every precaution to prevent spread of disease. And we are fiercely dedicated to being there for them and taking them through safe and healthy and close to their birth desires and preferences as much as we can. We are encouraging early discharge for moms if they are stable and their baby is stable, to try to get them out of the hospital, away from that exposure as much as possible. We really try to make the experience as close to what they want still as possible. We feel terrible about the visitor restrictions, but they are there for their and their baby's safety and the safety of all of the healthcare workers as well.
I don't know that I have really much else to say other than, again, to echo that we still recognize this is a birth, this is the beginning of a family, and that it needs to be celebrated and enjoyed. In challenging times, it's still the time for us to rise the best we can to support what we can in for our families. Our staff are absolutely committed and are here to celebrate the birth, to make it the best experience possible. And absolutely, we are all conscious of safety for the community, for ourselves, and for all around us. And so we make the best decisions we can with the information that's currently available. And please keep the dialogue up so we can be talking about how best to provide that care.
Thank you. There's a question to Lakeisha. And the question is, do you know if there are any doulas in the St. Louis area who serve clients on Medicaid and are able to meet with clients in person for support? And then they clarified a little bit, saying that they're looking for someone who could start via telehealth and later transition to in-person meetings and support according to the public health recommendations.
Okay, so can you all hear me? I don't
Yes.
know if I'm not. Okay.
Yes.
So right now, the St. Louis Doulas of Color Collective are an organization who services clients regardless of ability to pay. So that's our whole goal, is to help clients get the doula care that they deserve, because, you know, a lot of times some people can't afford it. So we do have some doulas that have done pro bono, and we have also, depending on which doula agency you choose, because all of us are independent doulas, we all have our own businesses. You know, we have a certain cost that kind of ranges between $350 and $500, depending on who you choose. Or so a lot of us have adopted payment plans. We have adopted sliding scales. So we really want to try to figure out how to assist those clients. A lot of us do have access to virtual support. So we've been able to talk to moms through email, talk to moms through text messages, talk to moms through video chat. I know a couple of us have HIPAA compliant ways of video conferencing our clients. Some of us are still trying to figure out how to do it. We're mentoring each other on how to get through all of it. But we are at this point pretty open to striving to figure out how we can best support the client that comes through the Doulas of Color Collective. So it's very possible. JB.
Thank you, Lakeisha.
You're welcome.
This question, I'm not exactly sure who this is for, but I'll just throw it out there and see if anyone can answer it. The question is for expecting moms experiencing a mental health crisis. Can BHR provide service to them at their home amid this COVID-19 pandemic? Not sure if anyone can speak to that.
We have a group at Barnes called the Perinatal Behavioral Health Group, and they are a group of psychiatrists, therapists, counselors, social workers who usually are in our clinics, our prenatal clinics with us, and provide mental health resources, support, therapy, etc. They unfortunately are all working from home these days, which is really frustrating for us, for our patients, for them as well. I don't know that they are able to go into anybody's homes for support, but they are working with all of our current patients remotely with telehealth.
Okay. Thank you. Another question to SSM, Mercy, and Barnes. What sort of collaboration needs to happen between the St. Louis Doulas of Color Collective and the hospitals to support patients both virtually and in person. Lakeisha mentioned that some of our clients have limited access to laptops, tablets, or phones with video capability. Are there any suggestions for assisting those families virtually? Also, many doulas are private business owners without access to protective gear, such as masks. Are there any organizations that can assist with a donation?
We are always happy to dialogue. At this time, I would not have any protective equipment to offer out to people. Certainly, anyone coming in the hospital, we would provide that protective equipment to. As we learn, we adapt as quickly as we can. The best information we have right now is that the risks of letting additional people in this hospital environment is a risk that we think is too great to take. And so challenging though it is in terms of the presence part of it, we really would try to, as best we could, support a virtual version of it. Unfortunately, we do not have laptops available here to do. We have great Wi-Fi, but I do understand that, you know, phones and FaceTime or whatever virtual house party, whatever virtual versions can be set up, we would certainly be happy to support our moms who are here in achieving that. Could be a great time to explore through some of our foundations if there are opportunities to add some additional assistive tools, but I'm not aware of any that we have on hand right now, other than we have something through virtual interpreter services if we need to. That's kind of a Skype view. I don't know if that could be adapted or not. We might be able to explore that.
At Mercy St. Louis, we do have the opportunity for virtual, so we can help connect the patient to her doula. As of today, we are still allowing doulas, considering them a member of our healthcare team. So we are really seeing those used mostly in our low-risk birthing center with those non-PUI or non-COVID positive patients. We cannot honor the PPE request. We are struggling internally, as well as every healthcare system in St. Louis, when it comes to PPE. Even having enough to protect our frontline coworkers has been a real challenge.
And I echo those PPE sentiments as well. I think we are all struggling to make sure that our frontline members of the healthcare system have them for their protection. So unfortunately, we don't have any to donate out. Because of the more restrictive visitor policies that have come into play from COVID-19, we have actually obtained a handful of iPads specifically for labor and delivery. And I encourage any of our doulas in the St. Louis area, if they want to virtually connect with our patients, we can absolutely support that.
Thank you. This next question, it states, Pamela, you mentioned that lactation support is provided virtually to patients at SSM. Is this support provided by Mercy and BJC as well via your lactation staff? What are you doing to collaborate with the LC working in private practice? And also, what are the protocols for supporting lactation when a patient is tested positive for COVID-19?
At Mercy St. Louis, we are exploring the virtual lactation option. We do over the phone now, but from a virtual perspective, really working with our compliance team to make sure that we have an absolute secure platform and the HIPAA component as well. So hopefully in final steps of rolling out virtual lactation, we do have phone services and Ask an Educator every evening so that there are platforms via phone today, but again, hoping to even maybe as early as week's end roll out virtual lactation. Our lactation services are fully functioning, caring for all patients, including our PUI and COVID positive moms. So those patients, the experience shouldn't be any different. They're still getting the same lactation support as a non-PUI or COVID patient or prior to this pandemic. Those services are the same. When it comes to private lactation, we can definitely work with moms, but most of what we're doing now, the suggestion is that it's virtually just to minimize exposure.
Thank you, Emily. Janie?
At Barnes, we still have our inpatient lactation consultants available. They're still in the hospital. They're still seeing all the patients, including our COVID PUIs if needed. For our COVID PUI patients, we do go through the CDC recommendations for breastfeeding in COVID positive moms. And that recommendation is that breastfeeding is still encouraged. But there's this suggestion, and it's the same for flu positive moms as well, the suggestion that they pump and wear the appropriate protective gear to feed their babies, including a mask. If they choose to feed at the breast, we teach the CDC guidelines. We encourage good breast hygiene and mom to be masked during the breastfeeding. I'm a breastfeeding mom. I definitely had the flu while breastfeeding my kids. The reality of actually making this happen for every single patient that you breastfeed with all of these other caveats, I think is probably not realistic for a lot of our moms, but we want to make sure that they know the data and that it's a kind of shared decision that we make together, and they make that the right choice for them and their baby, just like I did when I had the flu and breastfed my child. So that's where we are with breastfeeding. We have telephone support for our moms after they leave the hospital from lactation consulting, and we're working on teleconferencing as well for those lactation consultants.
Our lactation support in the hospital is still present and robust as ever. We obviously, again, follow CDC guidelines. We believe the benefit of getting baby breast milk for these COVID positive moms, PUI moms, is absolutely of great benefit, and want to try to support that as best we can. Frankly, one of the challenges we have for that mom who is either pumping and following the instructions as given, or that mom who chooses to put the baby to breast after great discussion and counseling and may feel that that's the way she would like to do it. One of the recommendations that is out there is that these moms use a mask, which of course we all think is the right and proper thing to do. We are challenged to think about it, and we had a great conversation about this yesterday internally, is where do we advise these moms get these masks from, because she's going to have a hard time finding them. And so, there's all kinds of rumor mills and anecdotal stuff out there about cloth masks and bandanas and things like that, and that may be the best that's available at the time without a whole lot of evidence to support that. In the hospital, we certainly have them for her, but once she goes home, we don't have a 14-day of supplies of masks necessarily that we can give her to use at that time if she is well enough to be discharged with her baby. So it is a challenge, and again, it's one of the things we really keep working on and trying to be as open and transparent about this as we can to support that outcome and getting maybe those great immunities from breast milk.
Thank you. That is all of the questions that we have. I want to say thank you to all of our panelists for sharing your insights and your perspectives. I want to thank everyone who's participating on the call today for all that you do to care for moms and babies in our community. Following this call, you can expect to receive a link to this webinar. Remember, we were recording it, a compilation of all the information and resources that were shared in the chat, and there's been numerous of them, so I'm really excited about that. And then also a quick survey. We'd love to get your feedback on the webinar and any information that you'd like to hear about or discuss moving forward. Please share the recording. Please share all of the resources that we share with you widely. The things that we've heard today will also help shape what the content will be for the next webinar, which will be Wednesday, April the 8th at 10 a.m. Thank you so much for your participation. We do have an advocacy slide. Do you have that up, Sarah? And again, it will be at 10 a.m. Here's a slide that just has some partner resources, opportunities, and some calls to action. There's the COVID St. Louis COVID-19 Advocacy and Resource Hub, which is a central place for petitions, policy updates, and community resources. We have the STL Response, which is a dashboard for regional resources and response. The McVie Emergency Action National Home Visiting Coalition, they have a sign-on letter that they're requesting funding and flexibility needed to respond to COVID-19. Operation Food Search is on here, and here's their website, as well as Legal Services of Eastern Missouri. They have a Facebook event that's happening on April the 2nd at 3 p.m. And they've been sharing more information on food stamp changes, the application demonstration, and they'll have live question and answers session on tomorrow. So we just want to be able to share resources as we know them as well, and be able to support, as you know, Lakeisha shared, all the folks are coming together in a mighty way to support moms and babies in our community. And we just want to say thank you. We can't thank those who are on the front lines enough. We're super grateful for everything that you do. And just want to say to everyone, stay sheltered in place, stay safe, and until next time, have a wonderful rest of your day. Thank you so much. This concludes our webinar.
Thank you.